Hi, my name is Juanita, and today's video is a presentation over attention deficit hyperactivity disorder, also known as ADHD. The PowerPoint that I included in this video is geared for the nurse who may be providing care for a child with ADHD, but the goal is to focus primarily on the pharmacological intervention options that could be used for these children. The objectives for today's presentation are for the nurse to be able to define ADHD, to be able to identify non-pharmacological treatment options, and to also be able to identify and describe medications that could be used to treat a child with ADHD. So what does ADHD look like? Not everyone has had the opportunity to interact with a child with ADHD. So I did include a YouTube clip of a child being interviewed who is suspected in having ADHD. I did mute the sound ears. So as you can see in the video, this child is having I guess a difficult time focusing on the conversation. She's very fidgety. She's playing with that pen in her hand and is just really not making eye contact with the person interviewing her. A lot of times parents will describe their child as doing similar behaviors as she is, maybe daydreaming frequently, forgetfulness, talking too much or distracting others around them, unable to resist temptations, just messing with all the different objects and things around them. Sometimes these kids have a hard time taking turns or just not being able to get along with their classmates. So like this child, in 2016, 6.1 million children were diagnosed with ADHD, and that's a total of 9.4% of all the children in the United States, and that age range was from 2 to 17 years of age. It's not uncommon for a child with ADHD to also suffer from another type of mental health disorder, such as anxiety, depression, to maybe even fall on the autism spectrum. Others are known to be diagnosed with Tourette syndrome as well. So the CDC does define ADHD as a neurodevelopmental disorder, which is characterized by hyperactivity, impulsivity, and inattention behaviors. There are different types of ADHD. So you'll have those who are predominantly inattentive. You'll have those who are more hyperactive and impulsive, and then you have those who have a combination of the presentation as well. Only a physician can diagnose someone with ADHD, whether it's a primary care doctor, a psychologist, or a psychiatrist. And that is based on the age group and the suspected symptoms. So that way they do meet some type of criteria, which is often used through the American Psychiatric Association's Diagnostic and Statistical Manual, the 5th edition. Non-pharmacological treatment options for these kids may include behavior therapy or neurofeedback training. So behavior therapy is an opportunity to strengthen positive behaviors and eliminate those unwanted behaviors or just the problem behaviors that the kids may be having. And neurofeedback training is aimed to achieve brain activity control through self-regulation. So that way there's reduced alteration in the cognition, in the emotions, and just in the behaviors of these kids. Pharmacological treatment options include stimulants and non-stimulant medications. So we have stimulants and non-stimulants, as we just talked about. Stimulants include methylphenidate, which is known as Ritalin. You also have dexmethylphenidate, which is Focalin, and lisdexamfetamine, which is also known as Vyvanse. Non-stimulant medications include atomoxetine, which is Strattera, clonidine, also known as Capvay, and guanfacine, which is Intuniv. So of those 6.1 million children that we talked about earlier, 62% of those do take medications for ADHD. 70 to 80% of them are on stimulants and have decreased symptoms while on that medication treatment. The remaining 20 to 30% of these kids are either on non-stimulant medications or some type of non-pharmacological treatment options that we talked about. So to compare stimulants and non-stimulants, stimulants are the first line drug of choice. They have been around and used since the 1960s. These medications target dopamine and epinephrine receptors and are usually very fast-acting medications. Once the child has taken it, you can see symptoms starting to improve after about 30 minutes to maybe an hour and a half from the time that it was taken. And if you recall, dopamine and epinephrine play a role in motivation, in controlling of movements and emotional responses. The non-stimulant medications are an alternative option. They were approved through the FDA in 2003. Usually these medications target norepinephrine and take about 2 to 4 weeks before they start to show improvement in that child's symptoms. The FDA has approved a total of 29 different stimulant medications, all of which have either methylphenidate or amphetamine components in them. Some of the adverse effects for stimulants include vertigo, hypertension, insomnia, confusion, nausea, diarrhea, or even the potential for addiction. Non-stimulant adverse effects include moodiness, dizziness, drowsiness, hypotension, and dry mouth. So upon completion of this presentation, we did talk about the definition or a description of ADHD. We had examples of non-pharmacological treatment options and pharmacological treatment options, which included the medication, the drug class, and also potential adverse effects. This is the post-discussion evaluation that is given to the nurses once the presentation has been completed. I do ask that they give 2 examples of stimulants and 2 examples of non-stimulant medications, along as filling in the chart that compares the 2 different medications. Sometimes people ask if the medications can be combined, and in fact they can. Sometimes physicians will prescribe a stimulant and a non-stimulant just to enhance the therapeutic response that that child might get from their ADHD. Oftentimes people want to know if the child has ADHD, will they continue to have it as an adult? And only 1 out of 3 children do continue into adulthood with ADHD, but they, at that age, have a better, are better at controlling their symptoms without medications. Thank you for joining me in this presentation over ADHD and pharmacological treatment options.